Hi, everybody. My name is Mackenzie, and this is my reflection on this week's material. I was surprised learning about substance abuse becoming more popular in young adults. I have never heard of the term M&M parties, where teens take pills from their parents' medicine cabinets and combine all the pills at parties to take them. I'm also surprised to learn about surveys that have shown 55% of those 12 and up have used prescription drugs for non-medicinal problems obtained from their family and friends. More education needs to be provided to patients to prevent their children from doing this, as it can lead to severe substance abuse. One thing that did not surprise me is how increased complexity of society, familial breakdown, and economic factors lead to increased substance abuse. Some people are put in a lot of hardship and stress without appropriate coping mechanisms and support, and unfortunately, they depend on drug use to decrease the stress and pain that they experience. 3 things that I learned about mental disorders. Number 1 is general anxiety disorder is twice as prevalent in females than it is in males and occurs in situations that most people would not find threatening. I also did not realize that this could cause a sensation of choking or smothering. Number 2 is I learned that those who anticipate their next panic attack may develop a fear of open spaces, such as leaving their homes. This is called agoraphobia. I actually did have a patient with agoraphobia who had childhood trauma, but overall led a normal life up until she was about 40 years old, when her husband, who she had helped battle cancer for many years, was found cheating on her after he came out of remission, and her post-traumatic life experiences all flashed back. She had gone over 15 years without leaving her house. She couldn't even open the front door and place 1 foot on the porch. This made it very challenging for her to make in-person appointments. She had to hire people to get groceries, pick up her prescriptions. She had home health nurses. She had people who would bring her dogs to get a haircut. This also forms concern about delaying medical care when needed, being unable to evacuate during a fire if needed due to fear of leaving her home, lack of exercise. Number 3 is I learned that there are many individuals who have milder forms of depression and are misdiagnosed or do not receive treatment because of it. Depression can affect almost all aspects of someone's life, including their sleep patterns, appetite, sex drive, self-esteem, motivation, ability to find pleasure, concentration. Screening all patients, even those who may present happy, is important because depression is a common problem and can affect one's quality of life. 3 things that I learned about substance abuse disorders. Number 1 is I learned that hallucinogens also have physical effects, such as increased blood pressure, nausea, and tremors. I learned that ecstasy increases basal metabolism and body temperature, which puts patients at risk for electrolyte imbalances, which can lead to cardiac arrest. And I also learned that more about the concept of synergism and the combination of alcohol and drugs, which makes a large percentage of hospital ER visits, and is also the primary cause of brain damage and death in major overdose cases. If alcohol is used with some anti-anxiety drugs, brain damage and coma may occur. Providing patients with thorough education about prescription instructions is crucial to establish that they are taking the right drug of the right amount at the right time for the right reasons, and avoid the use of alcohol specifically when the medication is contraindicated. So all of this material will be very helpful as a future women's health nurse practitioner. There will be plenty of opportunity to implement what I've learned regarding mental disorders and substance abuse disorders into practice. Educating women about the risks alcohol and drug use can bring to not only her, but also her baby during pregnancy is crucial. Providing women with the help and support they need if they do have a mental disorder or a substance abuse disorder may prevent their condition from worsening and may ultimately save their life. Screening for postpartum depression is important both during pregnancy and up to 4 weeks after pregnancy. I have learned many ways to recognize abuse and will be sure to perform a thorough assessment at each patient encounter. Substance abuse in women is trending up, so it is important to spread community awareness, have open conversations with patients, and provide resources that are available. Those with eating disorders may also ingest medications such as anabolic steroids that can cause mood disorders, hypertension, cardiac damage, liver cancer, and even sexual function and fertility or appearance. Discussing women's libido is also important, as decreased libido may be an indication of depression. The list goes on and on. Mental disorders and substance abuse disorders are both common and will be dealt with as a women's health nurse practitioner. Another important aspect is to increase communities' resources. Many women who may be using drugs at home may not want to come in for their prenatal visits because they don't want to be judged, or they don't want to be caught, or they may have financial instability. So giving them resources within the community may help save them and their baby. Thank you so much. Have a good week.